Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Lung diseases. Introduction. When you breathe, your lungs take in oxygen from the air and deliver it to the bloodstream. The cells in your body need oxygen to work and grow. People with lung disease have difficulty breathing. The term lung disease refers to many disorders affecting the lungs. Some lung diseases can lead to respiratory failure. This program explains lung diseases. It covers the general symptoms of lung diseases. It also covers common lung diseases and their treatments. The lungs. The lungs allow us to fill our blood with oxygen. The oxygen we breathe is absorbed into our blood through tissue in the lungs. When we breathe in, the air goes through our mouth and our nose. From there it goes to the throat, also known as pharynx. The air then goes into the windpipe, also known as the larynx and trachea. The windpipe leads to the lungs. From the windpipe, air goes into a number of increasingly smaller tubes called bronchial tubes. Small balloon-like sacs called alveoli are at the end of the bronchial tubes. Oxygen goes from the air into the blood through the alveoli. At the same time, carbon dioxide leaves the blood through the alveoli and goes into the lungs where it is breathed out. The inner lining of the bronchial tubes make mucus. Mucus helps trap dirt from the air. Small brushes called cilia protect the respiratory tract. The cilia constantly push the mucus out of the lungs automatically. If there is too much mucus, it can be coughed out. General symptoms. Different lung diseases share many of the same symptoms. The main symptom of a lung disease is difficulty breathing. Other common symptoms of lung diseases are a cough that gets worse or does not go away, a tight feeling in the chest, pain when you breathe in and out, unintended weight loss, repeated lung infections, shortness of breath or wheezing. Some lung diseases may also cause fever, hoarseness, sore throat or runny nose, swelling in the face or neck, weakness. Other symptoms may include coughing up blood, night sweats, thick sputum. Contact your healthcare provider if you have any of these symptoms or other changes. Only your healthcare provider can tell what is causing your symptoms.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Asthma. Asthma is a common disease that affects the tubes that carry air in and out of the lungs. Patients with asthma are sensitive to certain materials that cause an inflammation or swelling of the inner lining of the lungs. This swelling can cause the air passages to narrow. When an asthma attack happens, the lining of the lungs quickly becomes swollen. The air passages fill up with thick mucus. The muscles around the bronchial tubes tighten. This greatly decreases the airflow in the lungs and can be life-threatening. Some triggers of an asthma attack may include allergic substances such as animal hair, pollen, or mold, extreme conditions such as very cold or very hot weather, particles in the air from pollution, smoking and secondhand smoke. Treatment for asthma may include avoiding triggers. You can avoid triggers by bathing pets once a week, getting rid of household items that may accumulate dust, such as thick carpets or blinds, using air conditioning. You should also avoid smoking and secondhand smoke. Medicines are used for the treatment of asthma and prevention of asthma attacks. Medicines can decrease the inflammation of the bronchial tubes and decrease the sensitivity of the lungs to allergens. Some of these medicines act quickly and are inhaled. Others act over longer periods of time and are usually taken by mouth. COPD. COPD stands for chronic obstructive pulmonary disease. It makes breathing difficult and gets worse over time. In COPD, less air flows in and out of the airways. This may happen when the airways and air sacs lose their elastic quality. The airways make more mucus than usual, which can clog them. The walls between air sacs are destroyed. The walls of the airways become thick and inflamed. Smoking, irritants, and lung infections can cause inflammation of the bronchial tubes, the alveoli, and most of the cells lining the inside of the lungs. Preventing COPD is better than having to treat it. Avoiding smoking and the smoke from others is essential in preventing the lung damage associated with these diseases. Avoiding other irritants and pollution is also important. To decrease the symptoms of COPD, healthcare providers may recommend that you use a humidifier, chest physical therapy to improve coughing, supplemental oxygen, bronchodilators, medicines that open up the bronchioles, steroid medications to treat inflammation, antibiotics to fight infections. Infections. Many different infections can affect the lungs. These include influenza, pneumonia, tuberculosis. Influenza, also known as the flu, is a contagious disease that is caused by the influenza virus. Flu viruses attack the nose, throat, and lungs in humans. They spread easily from person to person. Infection with influenza viruses can result in severe illness and life-threatening complications, but most people recover within 1 or 2 weeks by drinking plenty of fluids, getting rest. To avoid spreading the disease to others, cover your nose and mouth with a tissue when you cough or sneeze. Stay home and avoid contact with other people. Wash your hands frequently. Pneumonia is an inflammation of the lung. When a person has pneumonia, lung tissue can fill with pus and other fluids. This makes it hard for oxygen to reach the bloodstream. With pneumonia, a person develops a cough and fever, and it might be hard to breathe. There are more than 50 kinds of pneumonia. Bacteria cause bacterial pneumonias. Viruses cause viral pneumonias. Fungi and other organisms can cause other types of infectious pneumonia. Antibiotics may be used to treat some types of pneumonia, such as bacterial pneumonia. There are also antiviral medicines that can reduce the severity of certain viral infections. With treatment, most types of pneumonia are cured in 1 to 2 weeks. Some people with severe pneumonia may need to be hospitalized to get better. Tuberculosis, or TB, is a bacterial infection that causes more deaths in the world than any other infectious disease. It spreads from person to person through air, as a person with active TB coughs, sneezes, or expels air. When treated, TB can be cured in 90% of all cases. The treatment consists of taking medicine for a period of months. People who have been treated for at least 2 weeks are usually not contagious anymore. Cancer. The body is made up of small cells. Normal cells in the body grow and die in a controlled way. Sometimes cells keep dividing and growing in an uncontrolled way. This causes an abnormal growth called a tumor. If the tumor invades nearby tissues and body parts, it is called a malignant tumor or cancer. Cancer cells spread to different parts of the body through blood vessels and lymph channels. Cancers in the body are given names depending on where the cancer started. Cancer that begins in the lungs will always be called lung cancer, even if it spreads to other places. Cancer tends to run in families, so people with close relatives that have cancer should be examined regularly for any sign of it. Experts also agree that smoking tobacco, chewing tobacco, and being exposed to tobacco smoke can all lead to lung cancer. Exposure to chemicals or other factors in the environment, like pollution or asbestos, might increase cancer risk too. Treatment of lung cancer depends on the type of lung cancer and its stage. People with lung cancer may have surgery, chemotherapy, radiation therapy, targeted therapy. A combination of treatments may also be used.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. When you breathe, your lungs take in oxygen from the air and deliver it to the bloodstream. The cells in your body need oxygen to work and grow. People with lung disease have difficulty breathing. Some lung diseases can lead to respiratory failure. Common lung diseases include asthma, chronic obstructive pulmonary disease or COPD, infections including influenza, pneumonia, and tuberculosis, cancer. Treatments for lung diseases may include chest physical therapy, lifestyle changes such as avoiding irritants and quitting smoking, medicines, rest and drinking plenty of fluids. For cancer, treatment may also involve surgery, chemotherapy, radiation therapy, or targeted therapy. A combination of these treatments may be used. Contact your healthcare provider if you have any symptoms of lung diseases. Only your healthcare provider can tell what is causing your symptoms.
Thank you for using Explain.